and welcome to another episode of the ACHPA Health Promoting Schools podcast series. Thank you for listening to this episode focused on how health promoting schools can be fostered and the newly released third edition of the resource, What is a Health Promoting School? Increasing Health Literacy in WA Schools, published by the Western Australia Health Promoting Schools Association. My name is Hugh Shannon and I'm a Senior Lecturer in Health and Physical Education at Queensland University of Technology and a member of the ACHPA Health Promoting Schools Committee. It's my pleasure to introduce the authors of this fantastic resource for school settings, Sue Dimitrijevich and Amanda Ferguson. Welcome, Sue and Amanda, and thank you for joining me in this conversation today. Sue, you were the project lead for this book. Can you give the listeners some insights into your background and involvement with this resource?
Yes, Hugh. I have had more than 40 years' experience as a primary educator, a principal, curriculum and resource writer, presenter and facilitator at all levels of education. And for the last 20-odd years, I've been a private health education consultant. And it was in this capacity that I wrote and researched and wrote this book for WA Health Promoting Schools Association, which we fondly call WAPSA. Interestingly, when starting to develop this third edition, I discovered that I was one of the 3 teachers who wrote a case study for the very first edition in 1995 when I was a teacher. So then in 2011, a team of 3 of us wrote the second edition, and now I've written the third edition. I'm passionate about school health promotion and education, and I continue to work, often in a voluntary capacity, advocating for education based on the Health Promoting Schools framework. I'm an honorary life member of WAPSA, having been a member for a very long time, since 1997, and I enjoy maintaining my networks with schools, universities, and other relevant health agencies.
Thanks, Sue. That's a great introduction. And Amanda, your role was project coordinator. Please tell us a bit about your professional work and contribution to this book.
Sure, thanks, Hugh. So I'm a public health nutritionist and have been with Foodcore Nutrition Services in WA for nearly 2 decades. And in that time, I've predominantly worked in the school environment to support the health in that environment specifically. I'm also the immediate past president and current treasurer of Focus, which is the Federation of Canteens in Schools. They're an advocacy group that focus on the school food environment. And I've been involved with, it's funny that Sue says WAPSA because I say WAPSA and it's always a bone of contention in WA. But I've been involved with WAPSA for as long as I've been with Foodcore, for nearly 2 decades. I have held a lot of roles within the executive committee as president and vice president. I'm currently on the committee. And together with the WAPSA committee, I was sort of the lead in writing the application to Healthway to get the third edition of the Health Promoting Schools book underway.
That's fantastic. That's really good background to get us going. So I'd just like to just take a moment to understand what was the original motivation for the first edition of this book? Why did we end up with this great resource?
Well, Amanda and I were having a quick discussion this morning about that, and really, we have no idea in 1995 because it was before our time, both of us. However, I do know a few of the people who were instrumental in writing it, and I think it was probably a very new concept in WA, and it was also written by the School Health Coalition, and that then changed its name sometime in the early 2000s from School Health Coalition, which started in 1989, to WAPSA or WAPSA. So one of the case studies, as I said, one of the 3 case studies was one that I had been asked to write from my primary school. So yes, we have no idea exactly why it happened, but we're very pleased that it did.
That's great. And so we hear heard a little bit there about the evolution of this resource, and we have a great resource that schools can use to consider how they can become health promoting settings. Now, before we delve into the content of the book, we should explore the core focus, which is the health promoting school. That's the core focus of this book. So what is a health promoting school, and why should schools be considered as health promoting settings? Why is that something that you both feel so passionate about?
I think I might maybe if I just go back a little bit and explain about the third edition, if that's okay, Hugh. So we kind of, both Sue and I had discussed sort of that the first and the second edition sort of being a fair distance apart, so 95 and then 2011. And then the third edition obviously was published in 2025. And we feel that, I mean, it came about because obviously the World Health Organization had released the new guidelines and the frameworks. And so that was really important for us to be able to disseminate that information to educators. But there was also a really important person that was part of WAPSA, which was Jill Darby. And she currently still is an adjunct at Edith Cowan University in WA. And she's been a long time member and contributor to WAPSA, and it was her that was sort of saying, are we doing another edition, because we use this in the universities and it needs to be up to speed. So if we're teaching about health promotion and health promoting schools, it needs to be relevant. So I guess that probably leads into that whole concept of what is a health promoting school and why that resource was so important. Anything else you wanted to add? No. So, and now I've forgotten the question that you asked, which was why is a school, why should it be, why is it so important?
Yes, yeah. What is the value of creating health promoting schools? Why is that something that's so important to you?
I think we probably need to understand about the importance of schools as almost like a prevention or a preventative health setting. If we think about the fact that the majority of children are at school for 14 years, they're a captive audience. It's a setting where you can have the most impact on health literacy and children's health that then leads into better health outcomes later in life, and also better education outcomes as well. So I think we need to spend more time focusing on schools as a setting for health promotion, because it can have the most impact for them later in life. So, developing something like the book that aligns with all the other frameworks and guidelines is just so important, because it gives the teachers and others at the school something to use.
Mm. And one of the quotes that I've used over many decades that I think it reflects that Amanda's thoughts there is that we can't educate children who are not healthy, and we can't keep them healthy if we're not educators. So I think health and education is just linked.
Goes hand in hand.
Yeah.
That's fantastic. It's great. Thank you. And just extending that thought there, collectively, what progress are we making in the health promoting schools space? Have we made progress and to encourage schools to be healthier places to live, learn, and work?
I'd say yes. We've definitely made progress, but probably not enough. I think if we consider the WA context, the government has, and health departments have significant policies and statements about health education and health promotion in schools. Earlier this month, the WA government released a statement about creating healthier WA school environments through the Healthy Schools program. So this is a grant program run through Healthway for funding between $3,000 and $5,000 per project application. And projects are required to adopt principles of best practice through alignment with the world-renowned Health Promoting Schools framework. That was from the media statement. So I think we have some impetus for promoting this framework, and we are getting schools on board, as you can see by the 13 case studies we have in this book. But I just don't know that schools see it as a priority. with the other thing that's happened in WA is that the Department of Education has created a category in their WA Education Awards in excellence in wellbeing and learning, and that's been for the last 2 years. And again, this is progress, but in my view, I think because it's not a core subject and it's more difficult to assess, it's not as black and white as other subject areas. And I think a lot of people don't want to teach. In my experience, I have found that people don't want to teach health education. They don't feel confident, or they don't see it, the value as health as a priority. So we need a whole lot more progress, I think. We need to change the perception that health education and health in schools is not a real subject.
Thanks for those insights, Sue. Now, students are an obvious focus for schools, as the core business of schools is to educate the next generation. However, the health promoting schools concept, it extends beyond this important group. So it obviously includes students, but can you give some examples of other important stakeholders within and external to health promoting schools?
Sure. And it's funny because Sue and I were also talking about this, because when we got into the final stages of the book, Sue said, I've made, and correct me if I'm wrong here, so she made a list of all of the external agencies that had been represented in the book, and there was over 81 of them. So you can see just by that sheer number, and this is just talking about 13 case studies, so 10 in the book and then 3 that are on the website. The sheer number of external agencies and organisations that had been involved in those case studies is so important, because I think it's really important to understand that you can't do this just in a silo. So for health and wellbeing to be really well embedded, bringing external organisations in is important. And even things like the Healthway grants that Sue mentioned give schools that extra capacity to be able to do things better. So maybe it's $3,000 to buy new equipment, or maybe it's to pay somebody to come in and give some kind of an overview of their project and then to work with the school for a term. I mean, I'm not sure, but I think internally what's really important is the teaching staff. And we often talk about that champion. So that one person in the school that just champions that health and well-being and is the person that continues to follow through to sets up the action plan and then follows through all those steps to make sure it happens. Having the support of the principal obviously is key as well. And sometimes the principal is the champion, or sometimes you've got a supportive principal and a champion, which is, the perfect match. Community health nurses in WA play a really big role in health promotion in schools, and that's fantastic, as well as chaplains. And then obviously all the other health promotion agencies that sit externally to that, just to help sort of drive that implementation of any project or program.
Yeah, thanks, Amanda. That's some really important points there. And having a champion in the school is so critical to success. And I guess an extension of that there is that we need people to drive these initiatives and have the passion and the energy to make them work on a day-to-day basis, and to generate discussion in the school setting is so important. But from a sustainability point of view, it's also important that we have a collective approach in that, so that when that champion, if they happen to leave that school or go to a different setting, that the ideas continue. That's the continuation is something that's so important. So just extending that point there, we have the Health Promoting Schools Framework, which was released in 1995 by the World Health Organization, which includes the 3 key interrelated elements: curriculum, teaching and learning, school environment, and partnerships. And more recently, the WHO followed up with the 2021 Global Standards for Health Promoting Schools. Why are these frameworks and standards, why are they so important when we're thinking about health promotion work in schools? Why is it important to consider these standards and the framework?
Well, number one, I think it gives credibility to the approach. It's a global, evidence-based, credible research that has informed this model. So I think if teachers are passionate and want to do something in this area, they've got a lot of evidence to back them up. I think that's number one, that's important. And it's long-term research too. I think that also sometimes people will see the word framework or global standards and they'll go, oh, well, that's not my business. I don't need to know about that. But if you take a step back and have a look at it, the new standards are really only the three circle model that many people who know about health promoting schools will be familiar with, and is what you spoke about with the curriculum, teaching and learning, school environment and partnerships. It's that and expanded. So it's a little more specific. It gives a little bit more structure to those three elements. The other difference, I think, is that it actually acknowledges the importance of government policy that strongly influences what education departments and therefore schools and teachers will do. And so in the book, I talk about that that part of the framework. Teachers, we need to know that it exists, but teachers don't have any influence there particularly unless we're going to get some passionate educators advocating for more health education, more value on health education, health promotion in schools. So it's really those three circles translated with a little more structure.
Thanks for that explanation. It's really good to hear. One of the sections in the book includes the title Health Promoting Schools Framework, a New Model for Health and Wellbeing. What I liked about this section was the call to action and some important considerations. We've just heard some of those considerations. If I'm a teacher in a school with a good idea and I want to implement these ideas, what are some of the key messages you'd like to share around this particular model and how we move forwards and improve schools as health promoting settings?
Look, as you spoke and Amanda did too a few moments ago, there are many key players. You can't, as a teacher, it's not one teacher's responsibility. We certainly talk about a committee of supportive people to work with these, developing these strategies and initiatives and implementing them. So it's really important to get the parents and the wider community on board as well. They all have a role to play. And I would very much encourage parents, and as a parent and a grandparent, I've been known to do this as well, but to actually ask the teacher or the principal, so what are you doing in health education? And provide some opportunities for some educational insights or just asking questions, because again, a lot of schools don't place a high value on health. And I think if there are passionate, informed parents or even agencies and representatives that can actually go into schools, and you've got to set up, people don't know what they don't know. So you've got to give that information as well.
Now, so some of our listeners, as I was saying before, may have some great ideas. And another part of your book focused on the importance of co-design. Why is co-design with students and other stakeholders something that they should really be considering?
Co-design, it's an interesting space, and it's one when we were writing the book, we had a discussion with the Department of Education, and it was really important that when we looked beyond just the internals of the WA Health Promoting Schools Association, and there's a number of people that are on the committee that, we have representatives on the WAPSA committee from mental health, from Kids Safe, from SunSmart. So it's the whole array of health organisations that work with schools. And it was important that we actually made sure that they were involved in every step of the process. And when we started to talk about the co-design of that with agencies, you then need to look at, well, what's the co-design process for students? And I know, and it sounds really odd to say, but we have to remember that children are the future, but they also understand what it is to have a lived experience. And unless we engage with them and we understand what that lived experience is and their ideas and their thoughts, then we can completely miss the mark. So I think it's vital that we focus on how being engaged in any project or program within a school can empower the students, that they want to be part of it. It gives them a sense of ownership. And it also helps to develop better relationships between the students and the teaching staff if they are all working together in unison, rather than just from this top-down approach, which I think sometimes we try to do, that we know better, but that's not always the case. So, if you look at co-designers, bringing in those external agencies to help the teacher understand that subject matter, and then the teacher to bring the students in so that she can understand what their perception is. I mean, it's the perfect scenario, isn't it?
It is, yeah.
That's my thoughts.
I think for me as a teacher, I always found health education to be intrinsically motivating, especially when it comes to talking about puberty and relationships and consent. And so that's my background, particularly over 40 years. So finding out what students want to know, as well as we can't just, because they don't know, again, they don't know the questions to ask because they haven't got the information, but it's about being realistic and knowing that we can't co-design everything all the time. And we also need to know that teachers have to work within boundaries and the syllabus. So it's really important to get a balance, but to ask students also about what is it that they're interested in. I think that's there's a lot of value in that. And I know that that's the approach that the education department particularly is taking with some areas. And I wonder if sometimes teachers are very set in their way of, this is the curriculum and I have to get through this, and and I understand that as well. So trying to find that balance is important.
That's great. Yeah, thank you both for the discussions there. Some really interesting themes coming through there around engagement, engaging the students, helping them develop that intrinsic motivation is important as well. It was coming through there, which is good to hear. And so important for we think of health promotion, the key outcome is we want people to make conscious decisions for themselves. So engagement and intrinsic motivation is so important. Another focus of the book is health literacy, and it's a clear focus. It's in the title of the book. It's and there's a section on the importance of health literacy. I'm interested in all the elements of your book, but this one in particular was a strong focus because it's an aspect of my research and my teaching work. And for those that may not be familiar with the term, the World Health Organization defines health literacy as an individual's ability to gain access to, understand, and use health information and services in ways that promote and maintain health and well-being. And what I also liked was the inclusion of functional, interactive, and critical health literacy, 3 different forms of health literacy, which have emerged from Professor Don Nutbeam's work in this space. And it's a focus of the Australian curriculum, Health and Physical Education. Health literacy is presented as one of the 5 propositions in the Australian curriculum, Health and Physical Education. From a practical perspective, how can teachers help students develop health literacy skills? Because the key thing is it's about skills. It's having skills they can use in their day-to-day lives. So how can teachers help them develop those skills? And also, how can teachers be positive role models within their own communities?
I think one of the biggest things that I found in actually teaching is that it's not, don't keep health education, health information to 1 hour a week on a worksheet. And I know that there are still teachers who are doing that sort of thing, probably because, again, they're not confident, or it's not their area of expertise, which most teachers it's not. So I think cross-curricular approach is so important to developing these critical health literacy skills. It can be covered in so many areas, just getting the same outcomes in your English or your reading or your language or your maths with the input of health information, health statistics, health, just everything. So I know I feel like I'm probably preaching to the converted here. Often for many people in your audience, they may think, well, of course, that's what you do. But there's a lot of people who are not passionate about this area. And so I think giving them ideas and opportunities to go, well, I could change what I'm doing now to this bit of information, which will increase health literacy and health choices and skills with my students. I think it's really important to keep parents informed, and that information is going to help potentially give parents the opportunity to improve their health understandings and health literacy as well, which then reinforces what we're dealing with and teaching students at school. Modelling healthy behaviour, I think some areas are much easier to be more obvious in modelling positive health behaviours, such as Sun Smart, nutrition. But because so many teachers don't know or understand this model or the importance of being a role model, I wonder if sometimes they understand some of their behaviours, how that it can impact their attitudes and behaviours, choices of their students. So there's a whole lot of ways, I think, that we can improve students' health literacy, and I do think that is a role of teachers. But whether teachers actually understand that or agree with it or want to, we need to provide opportunities for discussion with teachers about extending their understanding of health education and health promotion in schools.
Yeah, great points there. And yeah, it's I guess one great thing that we have is, because it is written as one of the key propositions in the Australian curriculum in health and physical education, it is there. It's meant to be an intentional focus within schools, and I agree that we've got opportunities to keep building that work. And there's some good things happening in some schools out there, but certainly a way to go in terms of improving that, and that comes with helping teachers understand what it represents and also how it can be included in their practices and their planning for their schools as well.
Hugh, can I just can I add, Sue and I, we often talk about how we have the same sort of analogies, and one of the ones that we use a lot is that you can't be what you can't see. And I think in the school environment, that is the utmost importance. And because I come from a nutrition background, when I think about creating a whole school approach or a healthy school environment based on nutrition and food, it really does need to be about role modelling from teachers as well, because children today and students today are very well aware of the foods in WA in particular that can and can't be sold from the school canteen. But if you've got a situation where the teachers are sort of not modelling healthy selections of foods and drinks, then it's quite conflicting, and students are a really impressionable age. And I think we often forget that if they see teachers standing in the playground without a hat on, for example, or drinking some soft drink that's probably not appropriate, then there has to be some sense of accountability for teachers to understand what that role modelling really does. And it doesn't mean preaching to the children about healthy choices and, this is a good food, and we don't use that language anymore. It's simply that visual aspect that I think sometimes is really important.
Yeah, that's great. Yeah, absolutely. They pick up on lots of things, don't they? The children, adolescents in schools, and that modelling is so critical. And I guess another aspect of that too is that we're all fallible. We all have make good choices, and we sometimes make choices that aren't so great in terms of our health outcomes. And as teachers in schools can also be good role models in terms of change and progress and where they've turned things around. And that part of that is being vulnerable and opening themselves up and saying, "Hey, I've made some, choices along the way which weren't so healthy, but I've made progress." And so that can also be a great learning outcome for students too. But obviously, it depends on whether the teacher was comfortable discussing that. But that can be good learning.
Stay tuned for part 2.